So I've got a patient that says, I don't want surgery, I don't want any medications, but I need to lose some weight. So Mercedes, what would you prescribe for that patient?
So I think whether the patient is taking medications or not, we really just focus on the lifestyle changes. That's the main thing that we always do when we first meet patients. Is like we talk about diet and exercise and behavior changes as well, because we understand that's really the key and the foundation to help you lose the weight, but also keep it off.
So, patients always talk about they are on meal replacements. What exactly are the meal replacements, and how would you describe that to patients?
So we use what's called an HPMR, or high protein meal replacement. The ones that we're using are around 27 grams of high quality protein. And then it's also low carb. It has very many vitamins and minerals, so you're getting a lot of nutrients in that you need, that you would be getting from a meal, but it's a great tool to replace a meal. And they can be used for short-term weight loss and then long-term weight maintenance.
Is it that chalky milkshake that people have been taking for forever?
It's not the chalky milkshake, and there are different ways you can make them, shaking them up really good, getting a good consistency.
Yeah, actually,
I think
our
these are the
patients,
best-
they're very happy with them.
Yeah,
They actually
they're
like
the
them.
best
They
tasting on the market.
Yeah,
They're
good.
They
Yeah,
come
they
back and
come
they're
in
like they're surprised that
they
they're
fly off
actually
the
very
shelf.
I know
It's
that's
not-
so many different flavors, and we're fortunate enough to work with that company that provides us with like 3 or 4 new flavors every season, and
Yep.
and still provides you with the right nutrition.
So
They're-
what's the difference between these and what we can get at Walmart?
the quality of
Quality of
protein? I would say.
Yes, absolutely. And also, I think
And
it's
the
because it
vitamins
keeps
as
them
well.
full longer. So many of my patients, when they try the OTC or they're over the counter, they're like, I'm hungry within an hour or two. With the meal replacements, they're like, they keep me full for about 3 to 4 hours.
These meal replacements are formulated by a board of doctors and dietitians, one
That's
of whom is
correct.
a board certified dietitian and doctor. And they study all the evidence every year about what's good or what's bad for obesity, and they finesse the ingredients. They have the right amount of carbs, the right amount of the fat, so you're not deficient in anything. It's 100% fortified with all the vitamins and nutrients that you need. So if they take my multivitamin beforehand, or a lot of these other supplements that they think is going to help weight loss, they don't need to, because these formulations work. The first weight loss clinic I worked in was about 30 years ago, and I didn't believe in these meal replacements. And now, I tried it for a little while there, and I lost 3 pounds in the first month or first week, and I was astounded. I
I'm
thought,
not
this
sure
is-
where
I'm-
you
I'm
lost 3
converted.
pounds from.
I used to be heavy. It took me 7 years to lose my weight. I tell people now, if I would have had this program, I would have done it in 2 months, because it is 10 times more effective than food-based therapy to help you lose weight.
So Sheena, are these patients going to be on these replacements forever?
No, you do not have to stay on meal replacements forever. However, they are helpful if you skip meals. We have a lot of meal skippers in our culture today due to families, busy, sports, really, really busy culture that we live in. So it's a choice. If you would like to be on a meal replacement forever, I think it's better than going to fast food. Most of our meal replacements, cost-wise, are less than $4 a serving, and the average person spends $8 to $12 at one meal at fast food or eating out. The medical weight loss program is a very low-calorie diet and a low-calorie diet. Maintenance plan could incorporate one protein shake, high-protein meal replacement per meal for those people who choose that. But dietitians like people eating real food. You can't live on meal replacements forever. Maybe you can, but I don't think it's a forever thing. I think that's an individual provider choice and an individual choice. I'm an advocate for meal replacements. As Dr. Havilana, I was not a believer as a dietitian, and meal replacements were the foodies. But seeing the results, and not just the weight loss results, but the improvement in people's nutritional quality of life, their sleep, they just deliver a really powerful punch when it comes to nutrition. And that's coming from a dietitian, and I would never really think I would say that, but I'm a big advocate for people using meal replacements for weight loss, and then if they choose to use them for maintenance, if they choose. It's a good alternative, and we sell. We have a lot of people who do. That's correct. They get into maintenance and they will do one product a day. And then if they get really busy, it's easy.
I think
cheap,
it's because
easy.
they live such a busy lifestyle. So normally, most people, I think they we skip breakfast most of the time.
Yes,
So that's
yeah.
when they use the meal replacements. Just convenient, you grab and go, and you make sure you get nutrients that your body needs.
That's